It's my distinct privilege tonight to introduce Senator Laura Murphy. Senator Murphy has spent the last 20 years as an active member of the Des Plaines community, including 8 years as an alderman for the city's 3rd Ward, and has over 2 decades of experience in healthcare and social services management. In 2015, she was appointed to the Illinois State Senate to represent the 28th Senate District, which neighbors O'Hare International Airport and includes all or parts of Arlington Heights, Des Plaines, Elk Grove Village, Hanover Park, Hoffman Estates, Mount Prospect, Park Ridge, Rolling Meadows, Roselle, and Schaumburg. Her working class background and previous professional experience inform her views on government as an entity that should work toward the betterment of the people and reinforce her belief in the importance of education, public safety, and fighting corruption and waste in state government. In 2020, she was appointed Deputy Majority Leader of the Senate. Senator Murphy lives in Des Plaines with her husband and her son, and it is my privilege now to introduce Senator Laura Murphy.
Well, thank you, Joe, and Gwen, Heather, everyone on the call. I really appreciate the opportunity to be here with you today, and everyone that's participating. I hope that you're going to have an opportunity to get an overview of what we accomplished in Springfield, some of the important legislation. We'll touch a little about the COVID virus, and I'll be happy to entertain any questions you might have. But I really, really appreciate the opportunity, and particularly the forum to use our public libraries. The libraries are such an important, serve such an important function in our communities, and they're such a catalyst to returning to normalcy. So I'm really glad that we're able to do this when the library is open and you're able to go in it and take out books and do all the things that that resource offers to a community. So I thank you so much. So should we get started right now with the PowerPoint? Okay, so welcome to the virtual town hall. So I want to start with a little of an update on what's happening with the COVID-19 virus. Certainly this attacked us with a vengeance, right? And I don't think that anyone, certainly no one has been responsible for the virus coming here, but I think that you should take some comfort in seeing that we have had some really great leadership of bringing Illinois back down, of doing the appropriate things that were necessary to protect the people in our community, to protect businesses in our community, and to do a slow reopening of our communities so that we can get back to some normality with the least amount of casualties possible. So that's the process and premise that the governor has operated on. It's been very thoughtful. It has been driven by science and epidemiology. All of the decisions have a science to back up why they were made. And, we're progressing one day at a time. It is a fluid process. And, there's not one person that has all the answers on this disease and knows exactly what path we're going to be following. So we take it day by day, and we're together, we're all going to get through this. So the COVID-19 has required, this is an overview of what we're looking at. Currently, Illinois has tested over 2.3 million people. We have just, it says 4%, but we're just a little above a 3% positive rate. And there was a point in time when we were over 20% positive rate. So that's why we had to go into that immediate shutdown and then try to recover from that point in time. So this chart will show you where we were at our peaks. And of course, the concerns about having those peaks were, and even because we have a 95% recovery rate, but what we could not do was overwhelm our healthcare system. so that we had every bed in a hospital that was taken up by a COVID ICU patient and leave no beds for other patients. Plus, there would be no room for people that needed the care, and particularly the respirators. So that was where there was a little panic at the beginning, where we needed the PPE, protective equipment, where we needed to ensure we had respirators, where we needed to ensure that we had all of the medication necessary to treat the COVID-19 patients. And that's what we did very successfully. We in the Northwest suburbs, of course, are surrounded by wonderful hospital systems. So that's why we have a potentially 95% recovery rate on that. So the reason we were able to get that spike down is we issued a stay-at-home, the governor issued a stay-at-home order. So we encourage people to stay at home. We closed businesses, anything that was not essential. And as we're opening up, we're requiring that people continue to maintain a 6-foot distance, that you wear a mask when you're out in public. And we also have a local ordinance in all the communities I represent, that list that Joe read. They all also have their own local ordinance about wearing masks. And then we encourage people to continually wash their hands as much as possible. These are the things that will stop the disease from spreading. And this is where we'll be able to come out on the right side of this. We have spent approximately, or the governor is given about $1.3 million to perform the test. And then we'll just progress on that. That's just for testing. There are a number of areas we'll talk about later of the amount of funding that has been given, mostly as a pass-through through the CARES Act, that allows businesses to open, that allows hospitals and communities and schools and everybody to go back to functioning. So as of June 26th, we are in phase 4 of the reopening. And that means that nearly 400,000 Illinois workers have returned to the labor force. Although this represents only about 7% of the labor force, it's approximately $30 billion in the annual GDP that have returned to normal operations. So we have zoos and museums and libraries and indoor dining with the appropriate spacing and social distancing requirements. Movie theaters and most businesses have been able to reopen. Now, you watch the news, we live in the Chicago area. Bars have been allowed to reopen, but that could be tentative, because if our numbers spike, you may see a local ordinance, particularly the mayor in Chicago has announced that she has no hesitation of shutting those bars should the numbers spike to where people will be harmed. So that's where we're at. With that. Now, probably one of the biggest concerns on people's minds right now are school reopening. And what is school going to look like? We abruptly closed schools on, I think it was March 17th was the date that schools were closed. Those that had seniors in high school or 8th graders, of course, missed out on all of their last year activities. But it was necessary in order to contain the virus and bring our numbers back down to where you saw in the first couple slides where they are at. So we understand, though, that Illinois is a very vast and different state. We have heavy population concentration in the Chicago and the Chicago suburban area. In fact, it's about, I think it's 9 point some million of our total population of a little over 12 million live in the Chicago and Chicago suburban area. So clearly, if you live in Southern Illinois, and the rules that apply in Chicago may not be necessary in your community, which is why the governor's executive order and guidance from the Illinois State Board of Education has said, we are going to allow local school districts to make the decisions for their own schools. So each school district is responsible for making the decisions on their school. They will be responsible for determining if they're going to open, if they're going to go to remote learning, if they want to have a hybrid of remote learning and in-person learning. And we all know that the remote learning is not the ideal. And it's particularly not ideal for some students that might need extra care. particularly students that have an IEP who thrive better in an environment with a one-on-one and a personal education, but we may not be able to do that. And so that's why the school district in conjunction with parents and their teachers and their unions will all be making that decision of what's best for that particular school district. So for instance, if any of you paid attention to, or you may have seen in the Daily Herald today, there were 2,200 parents that participated in a District 46, which is the Elgin area, in one of their school board meetings. Typically, nobody participates in a school board meeting, but in that case, there were 2,200 people. So they are soliciting the opinions of parents in making their decisions. I have gotten a lot of emails from people asking about what's the process, what's it going to do. And I continually suggest to them that they have to make their comments and opinions known to their local school district, because those are the people in conjunction with principals, superintendents, and teachers that are going to be making the decisions on that particular school. And it's going to look different throughout the state. Some school districts are going to open and they're going to continue and be able to continue throughout the school year. Some may start remotely. Some, again, might have that hybrid. Some might have to close if our numbers change. The only thing that's going to be a constant here is that people are going to have some flexibility. And I understand that that makes it difficult if you're trying to go back to work and you're planning for childcare and things of that nature. But the workforce, too, is going to have that flexibility as well. Colleges and universities also are on the same thing. Each school will make the decision on themselves of what they decide. So far, the University of Illinois is projected to open. Illinois public universities are projected to open. I haven't heard what our community colleges are going to do yet outside, and it varies by state. You know, the East Coast has decided to go right away, start with remote learning. Some Indiana schools have decided that they're going to open early and have students come, try and maintain a closed campus, and then have them go home for the Thanksgiving break and have that break until January. So because there are so many nuances in the school system, we do have to allow for each one to have their own individual input. Some of the things now we'll turn to some really what I think are the positive things that have happened in Springfield, and realize that we had a very, very condensed legislative cycle, because usually the General Assembly cycle works. People take their time with their legislation in January and February, because we know that people really don't start to negotiate on bills till the end of March, April, and May. Well, we too were abruptly closed as everyone else. So we had to then develop a system where we passed legislation that we thought was really necessary for COVID-19, what really was essential to getting things done. And then that's how the legislative cycle worked. We had working group conversations all by Zoom and remotely. And then when we went down to Springfield in May, we were able to quickly pass legislation because we had already negotiated the terms of most of the pieces of legislation. So one of the landmark pieces I think that we accomplished is to enhance our vote by mail system. And the governor signed this legislation, and that is going to provide people with some comfort level that they're still going to be able to cast their vote in the November election, that they're not going to be able to be exposed to any potential harm when they go to vote, that the number of election judges won't be needed, and you won't have to serve and expose yourself. We're still going to continue with early voting, with absentee voting will still be available, but it won't be as necessary, and there'll still be in-person voting. But what's going to happen in the vote by mail process is that, or you hear often VBM, is that any person that had voted in the last two elections will be sent a ballot application, and you can apply for a vote by mail. This system, while new to Illinois, has been working in other states for years. And it has been working without people, often you might hear comments that there's potential for fraud and abuse. That is not proved to be true in any of the states that have used it and have used it for a number of years. Oh, so here's voting is going to be made easier. If you haven't voted if you have voted in the past 2 years, you'll automatically get the application. Election day will be a holiday at every school, so that we won't have to worry about exposing children to any potential additional risk. Early voting is going to be extended so that the hours will be later, and particularly on weekends, those hours will be later. And all the COVID-19 guidelines will be followed for in-person voting. The sanitation and all those things will be required. So it should help people feel comfortable voting. So right now, you can apply for that application in early August if you haven't already completed an application. And this is very easy to go on the Cook County Clerk's website and apply for the application. Late September, the first ballots will be mailed. October 29th, the application has to be returned. You'll be mailed a ballot, and then you have until November 3rd. The ballot has to be postmarked by November 3rd. So it should be a really easy process. So some of the new legislation that I started to refer to that we talked about. First off, most importantly, we passed a budget. We passed a budget that was balanced, but it was balanced due to borrowing from the federal government. So there's a host of COVID-related 19 expenses that the state is going to incur. And in order to meet the needs of our communities, of our unemployed, to ensure that government steps up and does its role. And I think at no time has it been greater that government is going to have to step up, and it's going to have to assist people, because people are not going to able to go back to jobs that they traditionally held. The workforce is not going to look the way it is. Of course, the hospitality market has been decimated, and people that work in the hospitality area are having extreme difficulty. So the state is going to have additional resources. So we are either going to be receiving that money from the CARES Act. That's the latest round of federal legislation that is anticipated that's going to be passed to states, or the state will have to borrow, but the interest rate borrowing from the feds is significantly lower, and it doesn't impact our bond rating than if we were to go out on the market for bonds. So we'll go more into specific legislation, but we passed laws that we're going to, help all of those entities open. And local government can count on tools they need to respond to the pandemic. They have been given a significant amount of money, and it's been going through the county, through the state, and through the state budget. They are going to be made whole in all of their local government distributed fund, which is often the most important element that local government looks for, and that's the rebate of sales tax that goes back to the local government. Some things we've done too to help relieve the burden and in recognition of how difficult economic times are going to be is we've extended exemptions for homeowners. We've waived fees, we've extended the payment schedule. We've deferred property tax sales. We're trying to anticipate what could happen when people don't have any income to pay their property taxes. This doesn't take away from the fact that we still have to look at our whole property tax structure in Illinois, and that we will do that, and we will convene the property tax rebate groups that we're starting to meet and starting to make progress, but kind of got derailed by COVID as well. For educators, we made their license renewals easier. We said that students' mandatory tests would be waived. We set a precedent that no students' grades would go lower than what they were currently at before schools closed. And in labor forces, we enacted legislation that would protect workers from COVID-19, from on-the-job injuries. And we also worked to pass a bill that enhanced the city of Chicago and gave them a gaming license. So one of the most, I think one of the pieces of legislation that I passed this time that I'm most proud of is the Cards for Kids. And Cards for Kids is a program that I have to credit Joe for explaining the whole process to me initially. And then I worked for some students at Elk Grove High School that we were able to pass legislation that says even if you live in an unincorporated area, you would be eligible to participate in the library of your community libraries. Because previously, only students that lived within an incorporated municipal boundaries were able to utilize library services without paying for them. They had to pay for them. The statute was written that a library could not waive that fee, and they would have to pay. And if you're in a low-income family, often the number one item, if you're going to choose between buying food or paying for a library card, often food wins out as it has to. So we were able to pass legislation that will help those kids, and we may talk about that a little more later. We were able to pass some local infrastructure projects, and we have a significant amount of money coming into the Des Plaines area. The capital projects and the capital bills that were passed are give Des Plaines, you name it, and we were able to do that. We were able to fund this through the motor fuel tax, the road repairs. We're going to see, I often get a lot of questions on Algonquin Road. It's going to be done. You see the construction that's going on in Minor and Bussey and other areas of the city as well. The self-help pantry is going to get help, and they're moving. The Des Plaines Park District is going to receive a significant amount of funds. You're going to see the shoreline at Lake Opeka redone so that flooding doesn't occur. And there's just a host of money that's become available for most of what the city requested. We were able to help fund. And this 10-year capital plan is really going to make necessary infrastructure needs that we have delayed for so long. So what's really important this year, and we have to help our friends at the Census Bureau, is to get counted. Our census numbers are extremely important to provide funding for all of the services that the city provides and that the state provides. It has a trickle-down effect. And if we don't count every single person, we will have a significant reduction in services. You know, other states do a much better job, and Illinois has always been on the giving end of things compared to a lot of our other states, where we tend to be a payer rather, and we pay more into the federal government than we get back. This is one way to ensure some parity in that we get every single person counted and get the amount of money necessary for our communities. So there are census jobs available for those that might be looking. They pay $29.50 an hour. You can go to the 2020census.gov/jobs and fill out an application. But this map kind of tells you where we are at with responses in my district to that. These dark blue areas are good, and the lighter you are and the further away you are from the darker areas is where we need areas of improvement. So we all have to be in this together to ensure that people are filling out their census forms, and there is no requirement for citizenship on the census form. We just need to count everybody that's in the city of Des Plaines. So another thing that's really important, and I need every single business owner in the city of Des Plaines to recognize that there are grants available for them to assist where their businesses have been in trouble. I talked to a gentleman today who was a perfect candidate for the big grants, which is the business interruption grant. And that is a grant of up to $20,000 to local businesses to help you cover your loss of business. So all you have to do is take your, I think it's your second quarter and of last year, match it with the quarter of this year, and that's all you need to be eligible for the grants. In Displays, in 60018 and 60016, we are considered to be priority areas because we've had such a high number of COVID cases that they will receive priority status in the grant application. All you have to do is go on the Department of Commerce and Economic Opportunities website, and you will find all the grants that are available. So we've also, the federal government came up with additional $600 for unemployment that's provided on a weekly basis that will end the end of this month. The PUA program, which for the first time gave independent contractors an opportunity to apply for unemployment benefits as well. That was all provided through federal dollars. And then there's Rebuild Distressed Community dollars. So there is money available, and often, and as of right now, all of that money has not been utilized. So there is still an opportunity for people to acquire grants to help assist in their businesses. And I don't want any of that to have to be returned to the federal government simply because people didn't apply. So there's also help for families, and these are the numbers that are really important for people to recognize and to utilize should they need any assistance. ComEd has agreed not to cut off any customers. The governor signed an executive order that prohibits evictions. That will end soon, but so far people have been protected so that they don't have to incur homelessness after all of this. The Department of Health, Human Services, and most importantly, that if people have an issue with their mental health, they're going to have to, there's services available. We know that the isolation that some people feel often leads to other mental health issues. We want you to know that there is help available. So here's the rent and mortgage assistance, that there is up to $5,000, $15,000 for emergency mortgages. And this will be expected to launch August of 2020. You go to the IATA, Illinois Housing Development Authority, that is IHDA website, and they'll be able, the applications will be online starting August of 2020. So I was trying to finish under my deadline. And this is contact information for me. While my office is working remotely, we try to be as responsive as we possibly can. And unlike the IDES system, we do return calls in the same day. I just want to touch briefly on that. We know that there is a significant problem with them because all of a sudden they went from experiencing about 1,800 calls a day to over 1 million calls in a day sometimes. So, I mean, there's a huge, huge increase. They have hired additional people. It does require a significant amount of training because unemployment insurance is a very specialized area. They have brought on a consultant to help work with the antiquated computer systems that they're working with. And to help with training. We've recently brought on a call center that now will tell you that you can leave a number and you'll get a call back. Although I know that it's not as timely as we would like it to be, eventually it will get there. And then you can always call me and I will try to help escalate your cases to try and get some response. And then we do follow up until your case is resolved. So again, I want to thank you very much. I'm happy to entertain any questions, and I hope that it gave you a quick overview of things that are going on.
Thank you much, Senator. That was very informative. I have a question, and this is Gwen. Do you foresee another special legislative session before the end of 2020 to authorize additional COVID-19 funding and other assistance?
Well, we certainly will be waiting for the federal government. If they come out with the Cures Act that they are in discussions on, it's already passed through the House and it's under negotiations. And in talking with our congressional delegation, with our Senate delegation, they seem to think that another case is likely. Now, we are scheduled to go back into Springfield in November for veto session. So if they do something quicker, we could possibly do that, but we will definitely be there in November. And we will certainly enact any legislation needed to ensure people need to get the care that they need or the resources they need.
Thank you very much. I don't see any other questions at the moment. Now I'd like to introduce Brian Gorman, who is the Director of Outreach and Consumer Education for Get Covered Illinois. And if you're not familiar with what Get Covered Illinois is, it's part of the Illinois Department of Insurance and is tasked with providing information and assistance for Illinois consumers who need to enroll in healthcare coverage through the Affordable Care Act, also known as the ACA. Welcome, Brian.
Thank you, Gwen. Thank you, Senator, for your update. Thanks for letting me join you this evening. And I want to thank the Des Plaines Public Library for the opportunity to share some information. If I could get access to sharing the screen, that would be terrific. There we go. Real quick. As I said before, my name is Brian Gorman. I'm with Get Covered Illinois. Get Covered Illinois is part of the Illinois Department of Insurance. We work throughout the year with a variety of stakeholders across the state with the sole purpose to provide education, information, and enrollment support. Open enrollment period typically is from November 1 through December 15th, but we do all of our work throughout the year as well. And we're here tonight because we do know, kind of tailing off of the Senator's presentation, that there's a tremendous amount of uncertainty right now in the world as it relates to jobs. And certainly health coverage is going to be impacted by COVID and the economic ramifications of that. So we know that many people across the state have been separated from their employer-based coverage. But in fact, folks may be turning 26 and have aged off their parents' plans, or maybe they've seen a change in income or they moved. So we want to provide tonight just a kind of a brief overview of some topics, key components of the Affordable Care Act. I know that the ACA has been the law of the land for more than 10 years now, but we just kind of remind some of the benefits that people may or may not know exist. Talk a little bit about what Get Covered Illinois is, and then obviously application for benefits eligibility, which is the ABE system, a program administered by Healthcare and Family Services, which is our Medicaid program. So, and also make sure that people understand that there is free assistance for those that have a lot of questions. We know that health insurance generally is not the most intuitive resource for folks. So we want to make sure people to understand that you're not alone, that the Department of Insurance is here for you, and we're here to help. So the goals of the Affordable Care Act are fairly complicated, but essentially it is a large-scale insurance reform law. But for our purposes today, we're going to talk about how the ACA provides affordable coverage through two vehicles. One, the ACA Health Insurance Marketplace. People may know it as healthcare.gov. This is private insurance that's not sold through your employer. It's private insurance that you can purchase on the marketplace with financial assistance to help pay the premiums and some cost sharing reductions if you apply. So this is a vehicle by folks who do not have eligible for Medicaid, don't have an offer of employer-based coverage, or maybe older than 64 and then are be on Medicare. The health insurance marketplace is the place where you would find insurance for you and your family. The second element would be the Medicaid expansion. Illinois was fortunate to have been one of the early states which expanded Medicaid allowed under the ACA for those folks who may have been childless adults. Prior to the passage of the ACA, Medicaid services were only eligible for a certain segment of the population. Now Medicaid is eligible for those who qualify regardless of your your household status. So if you're a childless adult, you now may be eligible. Prior to the passage of the ACA, you may not. So there's some really important consumer protections that people need to understand and be reminded. The most important, I think, is the establishment of 10 essential health benefit categories. We'll go into a bit more detail on that. But essentially, it's the understanding of what is in the insurance plan cannot vary from plan to plan. There are things that may differ one plan from the next, but at its core, there are 10 essential health benefits that all ACA compliant plans must have. Coverage for people with pre-existing conditions, so guaranteed issue. You can no longer be denied health insurance coverage because you may have had diabetes and you may have been more expensive for insurance companies. They no longer take into consideration what your prior health is. They only look as to whether or not, whether you are a tobacco user or where you live or the household size, which determines your eligibility, but no longer any pre-existing conditions for that. Sorry about that. And then obviously the elimination of annual and lifetime dollar limits. Again, this is a tool by which people should not be going bankrupt because they no longer have health insurance coverage. So these lifetime caps that were some of the worst practices of the health insurance prior to the passage of ACA are no longer allowed. So we're going to talk a little bit about the essential health benefits. And these are 10. They are required under all ACA compliant plans: ambulatory care, emergency services, hospitalizations, maternity. The senator mentioned earlier, mental health and substance use disorder benefits must be covered in plans. And here in Illinois, they must be in parity with medical, surgical as well. Prescription drugs are covered. Rehabilitative disease management, lab services, and preventive wellness services as well. So, your vaccinations, your flu vaccinations, your annual checkups are all to be included within those 10 essential health benefits. So we're going to talk a little bit more about Get Covered and who can actually receive coverage through the marketplace. So the basic points are, look, if you live in the United States, if you are a U.S. citizen or national, if you're not currently incarcerated, and you're not provided health insurance through your employer, Medicare, Medicaid, or the CHIP program, or other sources that may qualify for what they refer to as qualifying health coverage or essential health benefit coverage. So, if you don't have coverage and you don't meet those criteria as listed here, then that's something that you may be looking to enroll in a marketplace plan. So when can I enroll in the marketplace? Well, obviously, the typical open enrollment period is November 1 through December 15th. When the ACA first launched, it was a 6-month program. It was shortened to 3 months. And over the last few years, we've settled from a 6-week enrollment period from November 1 through December 15th. And those plans are to begin on January 1. So if you enroll from November 1 through December 15th, your plan would begin on January 1, 2021. We're reminding everybody that, regardless of whether or not you're happy with the plan that you have on the marketplace, take some time. They change from year to year. The prices change. Your household circumstances may have changed. And you may benefit from an increased tax credit or saving dollars. So we're encouraging all Illinois residents, whether they have coverage in the marketplace or not, to take some time and shop around. And obviously, very, very important in light of COVID-19 and the impact on job loss is that a special enrollment period may be another period by which folks may be eligible to enroll. So you can sign up for an OEP or an open enrollment period if you experience certain life-changing events, and losing health coverage from job loss is one of them. If you moved from your current zip code or a different zip code, that may trigger a special enrollment period. Getting married, having a baby, adopting a child, those are things which would trigger the opportunity for you and your family to enroll in a marketplace plan, even though we are outside the traditional open enrollment period of November 1 through December 15th. And one other point that I think is very important is that you only have 60 days after the qualifying life event to enroll. So if you have been separated from your employer-based coverage, you can't wait 5 months to enroll in a marketplace plan saying, I lost my job. You need to enroll within 2 months or 60 days of that particular separation or the event, marriage, moving, et cetera, et cetera. So just kind of want to dive a little bit deeper into some of those special enrollment period events. Again, losing your health coverage, not choosing to separate, but if you actually, through no fault of your own, have lost your health coverage, including job loss. If you've seen a change in income and you're no longer eligible for a Medicaid program, when you churn from one program to the next, that would trigger a special enrollment period. If you move from a new zip code or out of Cook County to a different rating area across Illinois, that would trigger a qualifying life event. If you're married, having a baby or adopting a child, that changes your household composition, and that would trigger that as well. And obviously, if you're leaving incarceration or becoming a U.S. citizen, that too would trigger. But for most people who are probably tuning in right now who've experienced losing your health coverage through loss of job is something that people should enroll. So lots of questions. Again, as I said before, health insurance is often difficult and challenging, and we at the Department of Insurance and Get Covered Illinois are happy to share some of our tools that we have for you. So the best thing to do is go to getcoveredillinois.gov. Fairly straightforward. You can find what had traditionally been in-person assistance, but now we're able to connect you with a certified assister through telephonically, through email address. Find someone that works in your area that can help you walk you through what your options are. So all you got to do is click on the Find Help Assistance button on Get Covered, enter your zip code, search for help, and that will bring up certified assistance in your area that can help you walk you through that process. And they're available right now, so you don't have to wait to November to get that assistance. You can do this today. So at that point, once you've got the assistance that you need here in Illinois, the enrollment actually takes place through healthcare.gov. So while you can get information and find free in-person help on Get Covered, we will connect you through healthcare.gov through our website where the actual enrollments do occur. And everybody knows federal website where you can compare plans. You can shop for benefits. You can ultimately enroll. You know that when you enter your personal data, you'll know how much you're expected to receive in a tax credit to offset the cost of those premiums, as well as determine whether or not that you may receive cost-sharing reductions, which may impact your ability to lower your out-of-pocket costs. So I just briefly mentioned advanced premium tax credits or PTCs and who qualifies them. Premium tax credits are refundable credits that are issued to those that enroll prior to, so you don't receive them at the end. You actually receive those credits to cover a certain amount of your premium when you do enroll. Premium tax credits are on a sliding scale, so depending on, again, how large your household is, and what your household income will determine the amount of your premium tax credits. They're sometimes called subsidies or discounts. But it's important to note that 80% last year of Illinois residents who enrolled in marketplace plans actually did receive some form of premium tax credits to help them pay their premium. So really one of the benefits of enrolling in a marketplace plan, and it's the only place that you can get them, is the access to those premium tax credits, which can significantly lower what your premiums are each month. And again, these are only available by plans purchased on the marketplace. So when you go to enroll, there's a screening tool on healthcare.gov, which will determine, based upon the information that you provide on your household size and whether or not you or someone in your household is pregnant or expecting, and a number of different questions will determine whether or not you're eligible for Medicaid or for the Marketplace plan. So you don't have to know whether or not I am going to be Marketplace or Medicaid. The enrollment functions of the website will determine that for you. And it's also important to note that when you do enroll in a Medicaid plan, those same 10 essential health benefits that are found on those private Marketplace plans are contained within ABE. ABE is an acronym for Application for Benefits Eligibility, which essentially is the main portal for those who are interested in enrolling or eligible for enrolling in a Medicaid plan. But the real benefit to determining if you are ABE eligible, it also immediately connects you to other services that are available through states, including SNAP, Medicare Savings Programs, TANF. So once you actually get into the ABE system, it's fairly seamless to identify what other services that you and your family may be eligible for. So we've included the website for ABE. Again, Medicaid is operated through a different division of Illinois State Government, the Healthcare and Family Services, but we work very closely with our partners. All of our certified assisters here in Illinois know how to facilitate both the enrollment in a Marketplace plan as well as a Medicaid application. So enrollment assistance, again, I don't mean to belabor the point, but all of us know that enrolling and identifying a health insurance plan can sometimes be overwhelming, particularly if you and your family are going through a crisis and you've lost your employer-based coverage. We want you to know that the Department of Insurance and Get Covered Here is here to help. And there are local assisters in your community that you can call and reach out to and walk you through the different types of plan coverages that you might be available for. They'll help answer your question, and they can actually be with you online as you enroll in a plan. So you find the help in your area by going to getcoveredillinois.gov. You type in your zip code, and that will pull up a certified trained assister in your area. There are also a limited number of what we call federally funded navigators. Those also can be found as well. So whether it's a local assister or navigator or a CAC, the designation really isn't important. What you need to know is that they are certified and trained in cooperation with the Department of Insurance and Get Covered Illinois, and they're here to help you free of charge. And so obviously here's a wealth of resources. All of these links can be found on getcoveredillinois.gov. Again, that's getcoveredillinois.gov. That's a place where you can start the process for shopping, but also connect to a number of different resources and phone numbers for folks who may have questions or complaints about their current insurance plan or perhaps their Medicaid program as well. So with that, I'm happy to turn it back over to Gwen and the good folks over at the Plains Public Library, and happy to answer any questions if folks may have it.
Thank you, Brian, very much for all of that information. It's good to have. I had one question for you, and if you've already covered this, please excuse me. For a telephone number regarding Get Covered, is there one toll-free number you could recommend? We live in an age of technology, but still not everyone operates a computer or wishes to operate a computer.
Sure.
So people who don't go online and would like to speak to a live voice, what would be the number you recommend?
So for Illinois residents, not knowing what their eligibility was, you can call 866-311-1119. And then you can, from there, you can connect to either healthcare.gov, which is, that number is also available on our website, or the Medicaid number as well. But, again, the phones are available, but, the best way to enroll it is going to getcoveredillinois.gov, finding those resources, and then, that's the best way to go.
Thank you very much,
And
Brian.
then, you know, and the all the numbers that were listed on the previous slide are there for everybody.
Appreciate it. We do have a couple of questions that I would like to pose to Senator Murphy. The first one, a woman was asking what to do. Her husband received a key card, quote unquote, KEYCARD, from the IDES, and this came in the snail mail. She wrote that he did not apply for unemployment, and the two of them are concerned about possible identity loss, so possible fraud. What would you advise?
So, excuse me, there has been a breach of information at the Illinois Department of Employment Security. And to receive that card, that means that likely someone has filed a fraudulent claim on for unemployment benefits. So the first thing they need to do, and I typed this in the chat screen, is there's an 800 number that they need to call immediately. And they prompt number 1 is a claimant, and then number 5 as potential identity theft. And then, just like in any time that you may be concerned that your identity is at risk, they should check their credit scores. They should check with the federal government Commerce Department website to make sure that there is no fraudulent activity happening on their claims, on their identity.
And the number that the senator provided was 800-834-0513. Again, that's 800-834-0513.
Thanks.
You're welcome. The other question has to do, I'm just going to read this verbatim, it's not terribly long, Senator. What does the state plan to do to assist those that will face eviction following the expiration of the hold on evictions? There are many that have lost jobs that will face homelessness during the middle of a pandemic if resources are not provided.
So while we were very appreciative to get any type of CARES money and assistance for COVID-19 related items, the federal government specifically stipulated that it could only be used for COVID related items. So as we disperse money to local governments, it could only be used for things like PPE and other things of that nature. A police force, extra overtime, that was what it could be. So that's why we're hoping with the second iteration and under the CARES Act, we'll be able to enhance the fund that I mentioned earlier. In August of 2020, there is an opportunity through the Illinois Department of Housing Authority to apply for up to $5,000 if you're a renter, $15,000 if you are a homeowner for mortgage assistance. So that will help you stay in your home once those eviction, the EO for the executive order for the eviction stay is lifted. So there is a limited amount of funds in there right now, but in the Des Plaines area in 60018 and 16, we are considered to be in a priority population for the pandemic because of the highest numbers of COVID cases in the northwest suburbs. So we have a priority, making you more eligible for those grant funds when they start to become available in August, when the executive order is released.
Thank you very much. I would like to provide an update rather that Brian sent, and this is regarding the number that people need to reach a live person. For the marketplace, you can call 800-318-2596. Again, that's 800-318-2596 for the marketplace. And for Medicaid, 800-843-6154. Again, for Medicaid, that's 800-843-6154.
Thank you.
And I'd like to just reiterate what the senator said in response to the question about the key card that a constituent received in the mail, and this person had not applied for unemployment. Again, the number to call immediately is 800-834-0513. Select option 1 for claimants. Select option 5 to report identity theft. Do not activate the card. Keep an eye on your credit. Visit the Federal Trade Commission, which, if I remember correctly, the website is ftc.gov, so it's ftc.gov, to learn helpful tips on recognizing and reporting identity theft.
You know, if we have a minute here, if I could just add, what makes Brian's presentation so important is so many people, healthcare is tied to their job. And when you've had experienced a loss of job because of the COVID-19, it makes it essential that you apply for programs like the Get Covered Illinois, because that will relieve a huge worry off of you, the financial burden, you know, when you know that you have health care, it helps you sleep easier at night. So I definitely encourage people to apply for that program and to apply for all of the programs that are available. There is a number of them available. And even if you've never sought any government assistance before, this is the time when we're faced in this crisis to utilize those services. Thanks.
Thank you. Senator, we had another question about something you mentioned earlier tonight, the PUA, Pandemic Unemployment Assistance. I don't have detail here from the person who wrote it, but they seem to be having a problem with the PUA. Who can this person contact?
So I would, I'm sure they've been trying to contact the Illinois Department of Employment Security, but if they want to give me a call tomorrow at my office at 847-718-1110, we'll be able to help escalate their case. I'm sure they've already reached out to the numbers that they had available, so I'm happy to help. I might not have the answer, but I can help escalate your case.
Thank you very much. Appreciate it. Is there anything you can add, Senator, to what you already said about the Cards for Kids Act? Is there anything new that is going to be happening this fall, or anything we might want to be aware of or pass or try to help pass the word along on?
You know, since given the opportunity, I would love to further explain how that happened. I had known that unincorporated people that residents that lived in the unincorporated area were not eligible for library services. I did not know the extent of why they were not eligible until I talked to Jo when she told me that the Illinois statute specifically forbid them from utilizing services unless they paid for it. So we decided we could make it permissive, where communities could opt in to allowing their residents to obtain library services. And I happened to one day be speaking to the students at Elk Grove High School, and it's a District 214 school, and they said there were 3 students, and it was David Alvarez and, oh, I gotta find their names quickly, Miss Fuentes and Daniel Alvarez and David. So anyways, it was their school project that they took upon themselves, that they wanted to get legislation passed to change that process of not allowing library services to be available for people that lived in the unincorporated area. They were, and Daniel received a full scholarship to Harvard. So these are kids that were just, you know, incredibly invested in their studies, in their community, and they wanted to make a difference. So, you know, once explained to my fellow members and colleagues in the General Assembly, they felt like, of course, this is sometimes some things are just, I don't know why they take so long. It's not brought to their attention and not explained. We were able to do that, and then we were able to pass that as an essential piece of legislation in this last session, because particularly as we go into more remote learning, you know, kids have to have access to library services. So it was a group effort to help make that happen, and it's going to make a huge difference in a number of people's lives.
Do we have any idea how many?
Well, I know that in the unincorporated area, well, first off, there are approximately 36,000, I believe that number might be off a little, residents that live in the unincorporated area of Maine. And there are over 1,500 kids that come from the unincorporated area in Elk Grove at basically Chewy and Higgins that feed our local school system. So, you know, potential, and then that's just in our immediate area. This, of course, applies statewide. So anyone that lives in an unincorporated area, it can be made permissive if the library and library district, the library board, whoever is making the decisions at the library decide that they want to allow that.
You know, and Senator, if you will allow me to interrupt, I mean, we're so happy. I mean, as director of the Des Plaines Public Library, we're so thrilled because we've been trying forever to get those kids library cards. But I also know across the state, I'm on a director's listserv. And after your legislation was announced, particularly in rural Illinois, you can't imagine what this means to them because they're even more public library deprived than we are up here. I mean, there's just miles and miles of area where these kids have no public library. So as you pointed out, in ordinary times, but especially during this pandemic, for these kids to be able to, you know, double click and get into the electronic resources of all these public libraries, that alone is just, it's just a tremendous gift. So we thank you very much.
Oh, my pleasure.
Are there any other questions for State Senator Laura Murphy? We're getting ready to draw to a close. Senator, could you provide your contact information again for anyone who wanted to get a hold of your office?
Sure. And my office is right, not far from the library. It is located at 880 Lee Street. Currently, we are operating remotely, however, and we'll, once the, you know, the numbers settle down a little, we will go back to being in the office. But until then, feel free to call me at 847-718-1110 or Laura at senatorlauramurphy.com. And I just want to thank you so much for giving me the opportunity to participate in this event, to spend a little time with the library. And I know you're recording this, as some people might be busy this evening, but they'll be able to watch it at their leisure. And Brian, thank you so much for providing essential information on the insurance portion.
It's my pleasure.
Senator Murphy, Brian Gorman, thank you for all the time and all of the information. We are very grateful. And thank you for making the time to join us tonight.